Now we're going to move on to an exemplar related to bowel elimination. It's called diverticulitis. As always, grab your Davis book and a blank exemplar worksheet, and let's get going. So in order to understand what diverticulitis is, well, we have to think that it ends in itis, so we know that that has to do with inflammation. It's an inflammation of the intestinal wall. Now, diverticulosis is the outpouching of this wall into little pockets like this, all along the intestines. Diverticula are those little outpouchings. Diverticulitis are when those outpouchings become inflamed. Remember, anything that ends in itis, we know is an inflammation. So we're talking about an inflammation of these outpouches or these diverticula in the colon itself. So you know the phrase, an apple a day keeps the doctor away? Well, apples and fiber and plant-based foods probably help reduce diverticulitis. Why? Because what happens, the reason diverticula develop, our stool that has poor fiber intake slowly goes through the bowel, and these little diverticula outpouches kind of pop through. And then when those little pouches become inflamed or even infected, that we get diverticulitis. Now it's possible that many patients have diverticulosis and don't even realize it until they develop symptoms. So the one way we can prevent this is by having a good fluid intake and a high fiber diet that's going to prevent these diverticula from starting in the first place. Now, diverticulitis occurs in about 3 to 5 out of every 10 adults over the age of 60. Patients with diverticulitis are going to express abdominal pain, typically over the area where the diverticulitis is present. And most commonly, that's going to be in the descending or the sigmoid colon, which will be on the left side of the abdomen. They may have a fever if the infection is present, and white blood cell count may be elevated. There may be even a palpable mass over the area of pain. And the patient's stool is often going to be full of mucus or blood due to the inflammatory response inside the colon. Patients may also experience abdominal bloating, anorexia, meaning a lack of hunger, diarrhea or constipation, or abdominal distension, where their abdomen is extra enlarged. Remember back in our fundamentals course, we talked about how infections in older adults may manifest very differently with altered mental status and confusion and even falls. And that's the same for older adults with diverticulitis. They may not present with an elevated white blood cell count or a fever. They may present with altered mental status and confusion, which should cue you in to the fact that there may be an infection going on somewhere, specifically something like a diverticulitis. Now, in severe cases, patients can have a perforation of their bowel or a tear in their bowel, which is a bad thing because then the contents of the bowel and all of that bacteria then just enters into the abdominal cavity, causing something called peritonitis or an infection of the abdominal cavity itself. Patients are going to have significant abdominal tenderness and signs and symptoms of an infection if a bowel perforation occurs. Typically, a diverticulitis can be diagnosed on a simple X-ray, but CT scans may be ordered to make sure there's nothing else going on at the same time in the abdominal cavity. Remember, a CT or a CAT scan is kind of like an X-ray on steroids. So if we just need a simple X-ray, that's good. But if we need something a little bit more detailed, a CAT scan is going to do the job. So mild cases of diverticulitis can be treated outpatient with a 7 to 10 day dose of antibiotics, some specifically ones like Cipro or Flagyl that you're seeing here on this slide. And the patients will be encouraged to have a clear diet at home to kind of give their gut some time to rest. But more severe cases, patients with elevated white blood cell count, significant abdominal pain, advanced aged, significant comorbidities or signs of immunosuppression would need to come into the hospital, especially if they had a fever of over 102. Inpatients who are hospitalized would be given IV fluids. They'd be put on NPO, meaning nothing by mouth, to give their bowels some time to rest. And they may even need an NG tube placed for bowel decompression. So let's talk a little bit more about those antibiotics I mentioned on the last slide. Let's talk first about antibiotics in general. Here's some information you need to know about antibiotics. Antibiotics kill bacteria, and each antibiotic agent is going to target a specific type or types of bacteria. Antibiotics can be oral or IV, and the most common side effects to antibiotics as a general term are going to be things like diarrhea, nausea, and GI upset in general. As a nurse, you always want to assess for allergies before you give a medication, any medication, but specifically antibiotics. And you're going to want to obtain any cultures before administering, because if we're culturing a wound or if we're getting a blood culture or a stool culture, we want to get that before we start killing off the bacteria in that culture. So cultures before antibiotics. You're going to tell the patient that it's important that they complete the full course of antibiotics, because at first the antibiotics just sort of weaken the bacteria, but you have to take the full course in order to fully kill off that infection. You may want to consider probiotics to avoid secondary infections. Oftentimes, these antibiotics are so strong that they kill off the good bacteria in our gut, and it can cause secondary infections, diarrhea, yeast infections, and adding some probiotics to the patient's diet will help prevent that from happening. And then remember, with any extended release tablets, we don't want to have them crushed, and we don't want the patients to chew those, because extended release tablets need to dissolve slowly in the patient's GI's tract. So now that we've talked about antibiotics in general, let's take a look at two of those that are used for diverticulitis. The first one is metronidazole, also known as Flagyl. It's an antibiotic. It's also an antiprotozoal and even an anti-ulcer medication. And it kills bacteria, specifically anaerobic bacteria. And the one it's most common or most well known for in terms of GI infections would be for C. diff, Clostridium difficile. It's a great agent at killing C. diff. But what you really need your patients to know about this is Flagyl and alcohol do not mix. So you need to encourage your patients to not consume any alcohol 3 days before until 3 days after they complete their Flagyl dose. Why? Because if you have Flagyl and alcohol, you're going to have some massive violent vomiting as a result. Surgical management is only indicated for severe cases where bowel perfusion or obstruction or abscess have formed. An abscess is a little pocket of contained infection that's not responding to treatment. Or for a fistula formation where a channel has been created and grown by the body between the bowel and another pelvic organ. So those would be the indications for surgical management, often resulting in a temporary colonostomy. Now, complications of diverticulitis are going to include perforation, a break in the bowel, allowing the bowel materials into the abdominal cavity, microperforation, which includes little air bubbles escaping from the GI tract, an abscess, a pocket of infection that's unable to be treated by antibiotics, a fistula, a channel that grows between the colon and another organ in the pelvis, a bowel obstruction where the bowel is not able to pass any further, and significant bleeding. So the signs and symptoms of diverticulitis, you're going to look for things that are manifestations of inflammation or infection, tenderness, fever, an increased white blood cell count, as well as GI symptoms like bloody or mucousy stool or pain, unable to pass the bowels. In vital signs, you're going to see a patient who may have a fever, may have tachycardia. A serum potassium, your potassium may go down if you're on an NG tube, because the intermittent suction that a patient receives on an NG tube can lower the patient's potassium. Of course, we're going to be watching the intake and output anytime a patient is facing an elimination issue. We're going to be assessing for pain, because in diverticulitis is an inflammatory infected situation, which is going to cause abdominal pain. And we're going to assess mental status, because remember, those older adults may manifest with things like confusion and altered mental status rather than the classic signs of infection. Our nursing diagnoses or nursing problems are going to include acute pain and a knowledge deficit related to the types of foods or activities that the patient may need to do to manage this diverticulitis in their life. Specifically, patients really need to have adequate fiber in their diet to avoid their diverticula from becoming inflamed and infected. They also need to avoid consuming certain foods that are going to get stuck in those diverticula pockets, like seeds and corn. Now, remember, our nursing interventions are going to be related to things involving the concepts of elimination, the concepts of infection, and inflammation. So we're going to administer IV fluids to help with any dehydration that may be occurring. We're going to administer the prescribed antibiotics to take away that infection. We're going to possibly put the patient on an NG tube if that's ordered to low intermittent suction to allow that bowel to rest, and certainly provide any oral care necessary while the patient has an NG tube inserted. In terms of patient teaching, we're going to teach about those dietary recommendations, specifically to really increase fiber in the diet, fruits and vegetables, avoid straining, bending, or lifting, which can create more of those out pouches, more of those diverticula. Encouraging the patients to maintain a healthy weight or reduce weight if necessary. And then to make sure that they complete that antibiotic therapy as prescribed, because antibiotics not taken till the full last dose can result in the infection coming back. So how do we know it worked? How did our plan work? Well, the patient would be free of abdominal pain, free from fever. These are the types of things we're going to see as we're evaluating our patients with diverticulitis. And that's what you need to know about the exemplar of diverticulitis. See you next time.